This is a special podcast presentation from 700WLW.com. This is Doc Thompson On Demand.
Coming up at 10:33 this morning, Hillary Shelton from the National NAACP will join me to discuss the Dayton police the Dayton police recruiting, where they lowered the standards for the test. That's been a big issue. Lowered the standards so black recruits can pass. That was a mandate that was handed down from the Department of Justice, but we'll discuss that at about 10:33 this morning. That state representative from Ohio, Bob Hackett. How are you, sir?
I'm doing great, Doc. How are you doing?
Doing fine. I want to discuss this legislation that you're sponsoring, House Bill 93, and it's to battle the abuses of prescription drugs. First of all, what does House Bill 93 do?
Well, actually, Doc, it does five major things. The first thing, what it does, and I think the most important, it develops a licensing and law enforcement improvement program for pain management clinics. That's where we've seen the real major abuse, especially in the southern counties. Second thing, it develops a statewide prescription drug take-back program. It also develops Ohio automated prescription review system under the Attorney General. It limits prescribers' ability to personally furnish controlled substance. And the last thing, there's certain Medicaid reforms that are doing that will improve consumer education and allow for better care coordination. So those are the five major points of the bill.
The first point you made, where did you say the biggest abuses occur?
Well, it's shown that in the 10 counties with the highest death rate, 7 of them are located in southern Ohio. Actually, the two gentlemen that deserve the great credit on this, one is Representative Terry Johnson, who's a doctor from Scioto County, and they just have had an epidemic down there. You should have seen the testimony that we had of people coming up from Scioto County that who had lost their loved ones to prescription control abuse, the way this is, prescription drug abuse.
How does it battle the doctors that are handing out the stuff, just handing it out so they can make more money?
Well, the thing about it is, this is what we really want to do. Now the state board of pharmacy actually has to license these pain management clinics. And plus, there'll be some guidelines also for doctors to follow when they are actually dispensing, narcotic type drugs, controlled substance type drugs. Doc, in my area, I'm from Madison County, and even counties like mine, which is west of Columbus, we've seen a huge increase, and we call it the opiate type drugs, which are the prescriptions, the Oxycontins and the Percocets, et cetera. And it's gotten so bad that our county's developed a task force, and everyone's buying it, including the doctors, the hospitals, the local government officials, the human services groups, and we're working really hard. And it's happened in Fairfield County and Delaware County. It's really, a major problem here in Ohio, but I'm real pleased that everyone's working hard at it.
We just had the Attorney General on yesterday. He was on Willie's show discussing the big drug bust where he was working with the governor's office.
That's great. We need everyone to buy into this problem. It's just amazing. People don't realize that 4 Ohioans die daily from prescription drug abuse. 2007, there were more deaths from overdoses than there were from motor vehicle crashes and suicide. So it was the number one killer of injury deaths to Ohioans in 2007, and the trend has stayed right there. It's still really, really high. So, we're working hard, but we need to do better.
Talking with Ohio State Rep Bob Hackett. Don't get me wrong. I know prescription drugs. That's a huge problem. I'm mystified that kids would actually consider, and it's not just kids, but especially kids in high school and young adults that are like, sure, just whatever you got. Just what's in a prescription bottle. Sure, just hand me a couple. This attitude. But is it any different than alcohol abuse over the years, or pot, or some of the drugs that maybe were popular 20 years ago?
Well, and I agree with you, Doc. It's something, I'm 61, and we've gone through, I've gone through many generations, and when you look at it, you're exactly right, is that the bad thing about it is that look at the deaths and the response and how it destroys lives. So is it different? Yes, it's really harmful because, once again, in our county, we saw that there was movement then from prescription drugs, and because of the demand and the people addicted to us, then they were moving to heroin. And, heroin is a fairly cheap substance on the streets right now. And so that's the problem where we saw this transgression downward, to even more serious drugs.
So we know we've always got, when we're dealing with abuse of drugs of any sort, legal or other, it comes to, first of all, the desire to take them. So we've got to battle it on the desire to have them, the want, and then also the accessibility. And this is mainly about the accessibility, battling how accessible they are.
Yeah, I agree, and it's also education. The greatest thing about the way these communities, and once again, I'm going to talk about Scioto County. If you saw that testimony in committee and the lives that were ruined, there's a group of ladies that have formed a group and they've lost their loved ones, and they wear T-shirts, based on their initials. I forget what the initials were, but it was really dramatic. And so one of the other things, and this too, is we need to have better education. We need to better educate not only our young people, because we see the abuse everywhere. Doc, I had rotator cuff surgery, and when I got a prescription for a couple days of OxyContin, you'd be surprised how many pills they give out to anybody in a situation like that. And so you're right in that we need to have the doctors to buy in, and they really are, because they realize this has become a real problem.
All right, tell me about the other parts. The take back. What is the take back part of your legislation?
Okay, yeah, and I'll explain that real quickly on that. I've got that right here. The take back. Hold on. It requires the Pharmacy Board, Attorney General, and the Department of Alcohol and Drug Addiction Services to develop a program under which drugs are collected from the community for destruction or disposal. So the bill basically says to the Attorney General and to the departments involved, develop a program. So that will be in the makings, and that will be coming soon.
So the idea is if I have drugs left over that I didn't use, or they're old or whatever, I would have a place to take them.
Exactly. So they'll develop a program. It'll be all over Ohio. And then, and in addition with that, there'll be advertising too, and the local communities. I guarantee you, they'll buy in big time with this because, as I said, my community they're in love with this bill, and they think it'll work. It'll really, really work. But you're right. We need buy-in from everybody. We really need to change things.
All right, can you explain to me how the Ohio Automated RX Review System works? I know your bill enhances that; it bumps it up a little bit, but I don't know if a lot of people understand. This is something that was established in 2006, and it requires pharmacies to work together with a database so we can determine who's handing out drugs, who's getting them.
Yeah, and the modifications that this is doing, the bill modifies the operation, and it also establishes criminal penalties for failing to comply with the certain requirements of the system. You're right. It was established and maintained by the Pharmacy Board. It's a drug database used to monitor the misuse and diversion of controlled substances and other dangerous drugs. And also, Doc, that's part of the Medicaid part of the bill, too, is that in the Medicaid part of the bill, what they're trying to do is they're trying to find where they're having tremendous amount of use that's way above normal, and that they can come in and locate those problems and then better educate those people and find the problems. But once again, this is over all types of people. This is not a problem that's located just with our young people. It's a problem all over Ohio at all ages.
So the way this OARRS works, I'm guessing, or I'm trying to get the figure out here, is it would determine if I had a prescription handed to me or given to me by one doctor, and then a similar prescription handed to me by another doctor. So it keeps me from doctor shopping. Is that what it does?
That's correct. The bill establishes that the reporting system, must submit the following information: prescriber information, the patient information, the date the drug was personally furnished, the indication of whether the drug is new or a refill, the name, strength, and national code on the drug, and the quantity of drug furnished. So you can see they've modified it to get more information to be able to follow trends and see where the abuse is going.
But does anybody monitor that? Is there somebody that's paying attention to it? Does it say, okay, is it set up that, all right, this guy, Doc Thompson, has gotten, 4 doses of OxyContin in the last 2 weeks, or 4 prescriptions? Is that red flag, and then somebody investigates?
Yeah, red flag, and that's the great thing the day of the computer systems we are. It's a red flag, and then it goes directly to the Pharmacy Board, and from that point on, the Pharmacy Board is the one that takes the action.
Because I've heard, and maybe it's just I travel in shady circles or something, but I know people who have doctor shopped, that they go to a different doctor every day just to get the prescriptions and load up.
Doc, I'm impressed with your knowledge of this problem. You're exactly right. And that's an issue that was really a major problem, sometimes in southern Ohio. So remember, we're shutting down these these pill factories down in southern Ohio. The problem is, there'll be movement to somewhere else. And so we have to be really alert and vigilant to make sure they just don't move to a different type of system. Because it was a huge, millions of dollars of type of business. When you look at the amount of volume that's being used. So it's just something that we let get out of order, and we shouldn't, got out of control, and we should have done a better job, all of us.
Talking with Ohio State Rep Bob Hackett. Before I let you go, I got to ask you, since we're talking about Medicaid anyways, Governor's budget was out Tuesday night, and I haven't gone through all of it. It's 774 pages. I'm sure you probably haven't had an opportunity to either. But Medicaid is... Man, that's a huge problem for us. Over a third of the state budget is Medicaid, the way I understand it. We know the pressure is going to be greater in the future because we've got more people that are going to be on it just for the seniors. And then you've got the federal government that's going to give us less. This seems very unsustainable to me.
Well, two things. And actually, my wife's a real expert in the field of Medicaid and health care. One thing is, if you look at our costs of Medicaid health care, 4% of the people have almost 47% of the cost. And these are the people, these are the age, blind and disabled, A, B, and Ds, et cetera. And they were under a fee-for-service program. This part is going to be moved back, in my opinion, of reading the bill, to a managed care type of system that will do a much, much better job of controlling. The way it's explained to me, of the 4%, 75%, 3% of the 4 can be done, controlled much, much better. That's the first thing. Second point, if you really read the bill, is there's certain things that are Medicaid paid outside of the general fund, and they have, a tremendous amount of federal matching, and some of that is also being brought into the bill and brought into the general fund, which will help us balance. It'll do a good job that we'll be able to direct some more federal dollars to the Medicaid issues that we have. So, those are the two things that they're going to do a much better job of controlling the health care cost of Medicaid. But you're right. I mean, we're all sitting back and saying, but we hope he can do it. We really hope it can be done. I know I'll be the perceived as the ogre here, the mean one for saying this, but I'm just wondering if we're not at a point, with a lot of things. We're dealing with SB 5, all these other things, where we have to step back and say, okay, obviously what is the role of government, but what is a true emergency as far as things we're going to cover when it comes to Medicaid and Medicare and health care in general? Are we just going to make sure people have the basics? What about welfare? Maybe it's time we say, okay, it's just to sustain life until you can, go out and do it for yourself, as opposed to, hey, you're supposed to have everything you want just because you exist. And you're right. I think when I go around the state and talk, most Ohioans agree with you. And what we say is, that those that are, that really need the care and really need the assistance, they better not be cut out. We're strongly behind. But you're right. We all agree that there's many that have come in on the fringe that, that things need to do better. We're saying the word all over. It's not just Medicaid. We're saying the word. All our divisions need to be reformed. This is a reform budget. There being major changes. You know the Senate Bill 5 issue, but when you look at the situation like this, we cannot afford to operate government to the level that we did. But the great thing this governor is trying to do is he's trying to maintain the services to the people that need them, and he's trying to make the reform and say we've got to become much more lean and mean and much more efficient. So we're seeing major cuts at the agencies. Each agency, we're going to see mergers and things like that, and so. I really, so far, I like the budgets because I was scared to death. I thought the schools were going to get cut more. I think that's a lot of other people thought the schools were going to get cut more than they did. They're still getting major cuts, and local governments are getting hammered. And so, it's going to be, some difficult times. But, we're concentrating on trying to, up the revenues by working on jobs, bringing companies in. We're getting a better tax environment to attract companies. So, we know the way to work our way out of this, and it's not to increase taxes. The way to do this is increase revenues by bringing jobs to Ohio.
Ohio State Representative Bob Hackett. By the way, I'm going to let you go here, but you might want to be listening after we come back from the break because you were talking about Medicare. One of the problems, or Medicaid, one of the problems with Medicare and Medicaid is the corruption. and the waste and the screw-ups that hurts us. I got a story coming up next, Bob, about Medicare screwing up and is actually going to cause a lot more hard times.
Yeah, so. I will. I'm in my office. I'll take a minute and listen. Thanks, Doc.
Thank you so much, sir. I really appreciate it. It's Doc Thompson, 700 WLW. Katie Morgan has your Fox 19 Storm Tracker forecast. She says warm conditions this afternoon. Sunny and nice, high around 70. Increasing clouds tonight, overnight low around 50. Beautiful tomorrow, mostly cloudy skies, high around 70. Could see some rain tomorrow afternoon. Hopefully that holds off. Currently 44 at the big one. Medicare has screwed up. It's going to lead to some hard times for some people. It is against the law for Medicare to pay claims for prescriptions of Viagra. But that didn't stop them from paying claims worth $3.1 million. This according to the Health and Human Services Office of Inspector General. They determined that $3.1 million were paid between 2007 and 2008 for Viagra, even though it's against the law. Now, there are many, many things wrong with this story. First of all, that's not something we should be covering. No, I'm serious. We have got to the point where we have to look at life and death situations. In these situations where we are paying Medicare and Medicaid, where we are providing these things, it needs to be for the people who truly need it. And I'm sorry, Viagra for a good time, that's not truly needed. Wanted, liked, I'm sure appreciated, but it's not life or death. It may feel like life or death, but it's not life or death. They made there was a mistake in their editing software that allowed these claims to be paid. Now, the Office of Inspector General for the Health and Human Services Department said that they are going to try to recoup the payment of the drugs. I don't know how you would go about doing that. They say they're also going to strengthen the internal controls to help ensure that the drugs covered by Medicare Part D comply with federal requirements. Here's what I want to know. How come every other week we find a story like this in some part of the government where a mistake was made and we're on the hook for it financially? And they always say the same thing. Well, here's what happened. They passed the blame, but we're correcting the problem. And the problems never get corrected. Why is it illegal? Well, it wasn't always illegal. Pfizer makes it. Pfizer manufactures it. Congress stopped covering Viagra from Pfizer in a Hurricane Katrina relief bill in 2005. All right, there's problem number one. I'm tired of them throwing all this other stuff in bills. Had nothing to do with, did it have anything to do with Katrina relief? What, were people abusing Viagra as part of the Katrina relief effort? Then it shouldn't have been in there. But they rushed it, so that's another problem. They rushed to put it in there because there was some public outrage, because the New York Medicaid, which is the state program, was paying for prison inmates to take Viagra. Well, you got nothing better to do in prison, I guess, right? So that would be the third problem. Finally, Pfizer is still allowed to sell an identical drug. It's virtually the same as Viagra, but it is prescribed for vascular degeneration. And they sell it at a much higher price. There's two additional problems. Number one, you're selling the same thing. You know there's going to be abuse. Number two, you're selling it at a much higher price. If it's virtually the same, why would it be a much higher price? And who's paying for it? The corruption, the idea that they would cover any of these things anyways? You and I are. It's Doc Thompson, 700 WLW. Doc Thompson on 700 WLW. Lance's deal of the day. Just in time for St. Patrick's Day. Half-priced Irish food and drinks at Bagpipes Irish Pub. All you have to do is go to 700WLW.com, click on Lance's Deal of the Day, the big banner, and you'll get $25 for only $12.50 at Bagpipes Irish Pub, downtown Cincinnati, from 700WLW.com. I want you to imagine for a second you have children in school. Maybe you do have children in school. Imagine being an elementary school student. Think back to when you were in school. Maybe you take your kids to school on a regular basis. You have kids in elementary school, and you know the rigmarole that you have to go through with getting them ready and dropping them off and all of the crazy things that school want kids to do now. There is a school in Edgewater, Florida, that is requiring kids to wash their hands several times a day, to rinse their mouths out several times a day, requiring that the teachers wipe down the classroom several times a day, all because one student at the school has a peanut allergy. It takes up about 30 minutes of class time, cumulative, every day. The kids have to rinse their mouth out, wash their hands. The teacher wipes them down, wipes the class down, wipes the desks down. They have even brought in a peanut-sniffing dog. A peanut-sniffing dog to the school has to be brought in once a week to make sure there are no peanut particles. I, as a student, would be hacked off that I couldn't enjoy a peanut butter sandwich. I would certainly be hacked off that you're wasting all of my time. I have to stand there, rinse my mouth out, wash my hands, do all this other stuff, wipe down the classroom, all because one student has a peanut allergy. As a parent, I'd be ticked off at this as well. And there are a whole lot of parents that are ticked off. The school's standing by it, though. School said, no, they are obligated to do it because of the Federal Disabilities Act. According to the principal, she said it would be the same thing as putting a handicap ramp for a student that is physically disabled. Is that really the same thing? Peanut sniffing dogs because one student has a peanut allergy? Now, the girl's mom defended this. She said, we're not talking about she will break out in a rash. We're talking about she will die. Stop breathing. Oh, I don't dispute that it's serious. I don't doubt that at all. But why is a possible problem with your child supposed to change everybody else's behavior? Why does it stop at the school? Why did we outlaw peanuts altogether? I mean, after all, this girl, if even peanut dust, a few particles, gets in her system, she could, as her mom said, die and stop breathing. Why do we allow them at all? Would you, as a parent, if it was that serious, would you allow your kid to go to school? Would you put that responsibility on the school and the other kids? If it's that serious, if you are the parent of somebody that has a peanut allergy to this level, it's serious to the point that they have to bring in peanut-sniffing dogs, and they're wiping down the classroom and all of the kids and even rinsing their mouths out, then it's serious enough that your kid shouldn't be going to school there. I wouldn't allow that. I wouldn't allow a school where I have little control over as it is. I wouldn't put my kid's safety in their hands like that. What happens if the dog doesn't make it that week? Or some kid forgets to rinse his mouth out? She could die. Stop breathing, as her mother said. A couple of the other parents said, I don't think my child should have to rinse her mouth out 3 times a day. Another parent said, teachers and parents are walking on eggshells. They're right. How come everybody else has to change their behavior? Doesn't it make sense? Isn't it more practical that this girl change her behavior, that the parents change this one child's behavior? That's what we got now. One person has an issue, everybody else has to change their behavior. Schools say they're standing by it. Kids required to rinse their mouths out before entering the classroom every time they enter. They go out to the hall, they go to lunch, the next morning, they go out to recess, they come back in. I don't know, maybe there are loads of peanuts on the playground or something that the kids are smuggling in. Maybe it's a controlled substance out there. Psst, kid, you want some peanuts? So they're making them rinse their mouth out when they come back. Teachers have to monitor this as well. So now you got the teachers making sure they monitor. And then, of course, the peanut-sniffing dogs. Her father, the girl's father, says that if his daughter even smells peanuts, her reaction could be fatal. He says, we fought very hard to put certain things in place to keep her alive in school. She's already cast out. She can't do things most kids can do. How do you truly level the playing field? Yes, it's unfortunate that she has it. It's horrible. You're right, there's things she can't do that other kids can do. But guess what? Kids who aren't as bright, there's plenty of things they can't do. Some kids are athletically gifted. The rest of the kids aren't. There's already things she can't do. I am tired of this me attitude. You got a problem? If your kid has this issue, then you take care of it. Am I wrong about that? Jeff in Anderson Township. Am I just being the ogre, the insensitive one who's not caring that this girl could die any moment?
No, not at all. That's completely crazy. I have a little brother. He's actually allergic to, to peanut butter plus, not to peanut butter, but, just peanuts in general and eggs. And we had Reese Pieces in the house, cake, eggs, all that stuff. He was completely fine. Well,
I don't know how allergic he is. Maybe this girl, it is that serious that, that even if she
Well, he ain't even allowed
smells
to eat it. That's why he ain't, But, we had it in the house, though, Reese Pieces, all that stuff.
Maybe she truly can't be around it where it's in the house. Maybe her situation is different, is the point I'm making. But even if it is, why does everybody else have to change their life?
Yeah, they shouldn't make the other kids suffer about it. But, yeah, I understand. That's all I got to say, man. You have a good one.
Appreciate the call. Thanks so much. More of your calls coming up. Don't forget 10:33. A gentleman from the National NAACP to talk about the recruits and the testing in the Dayton Police Department. It's Doc Thompson, 700 WL. Doc Thompson at 700 WLW. Eric Dieter's in for Willie today. St. Patrick drove the Snakes out of Ireland at 12:06. Eric drives Willie to the airport. Right here on 700 WLW. Peanut-sniffing dogs, that's what we've gotten to. Don't worry about the drugs in schools, any of the other problems, kids falling behind math and science. Now, we're worried about peanut contraband in elementary schools. Aaron in Dayton, you're on the big one.
Hey there. First of all, I wanted to say thank you for taking my call. I agree with you that maybe the parents shouldn't be putting the kid in that situation. Especially because, as you said, they never know what's going to go on at school. But I do feel that the other kids should be tolerant of a kid with a disability. As you said, there are kids with learning disabilities. There are kids who are actually physically able. Just like a school should be looking out for their good.
Wait a minute. Wait, you said they should be tolerant. How are they not tolerating her? No one's calling her a peanut freak. No one's saying she has to eat peanuts. They're just saying they don't want to go through all of this stuff when it's much simpler for her to stay home or be homeschooled or go somewhere else.
Well, I didn't mean tolerant, but I mean, they should, you sort of teach kids to be sensitive to the other thing, to the other kid. I do agree with you that maybe dog sniffing, peanut sniffing dogs and up to the extent maybe that's a little bit going too far. But I don't think it should be the stance of the school to not have this kid in the school.
Aaron, you seem like a reasonable guy. You seem like somebody who is understanding both points, and I really appreciate that. But this is a good opportunity for me to remind you, I'm not being insensitive to this girl's plight. I'm not being insensitive that she has this. It's horrible. Thank God my son doesn't have that. But there are limitless things that kids are faced with. And it is unsustainable to say we are going to change everything about school that could affect anything that a kid has. Should we not allow the word divorce in school or any stories about broken homes? Because some kids may be from broken homes and it may upset them psychologically. I mean, the list is limitless. It's like, it's the same attitude about political correctness. Because somebody says they're offended by something, everybody else has got to change. You know what? I'm bothered by the word grapefruit. Please don't use the word grapefruit anymore. It's much simpler. It's more practical. It's common sense that says, if this girl has a problem, how about changing her behavior as opposed to everybody else's? Jason checked in via email, doc at 700WLW.com, is obviously missing that point because it goes back to the emos. Jason is very emo, very emotionally driven. I understand that. It's good to have emotions. I have emotions, but I understand being practical as well. He said, and maybe instead of being hacked off, you and those students could learn to think of others before yourself. Anyone hacked off by this thing, which will kill this child, is selfish, is a selfish person. Sounds like all the malcontents can learn a good lesson in thinking about the well-being of others. Jason, are you? Is this girl, her parents, are they thinking about others? They're saying because I have a problem, speaking on the girl's behalf, because she has a problem, that everybody else has to change. Isn't that selfish? She's being more selfish. She's disrupting, and her parents, the entire school. And costing money and time, taking time away from the kids to learn. That's not selfish? See, you see this as life and death. If it is really life and death, as they say, then she shouldn't be there. Now, Kyle had a good point. He said, Doc, instead of having the hundreds of other students take the 30 minutes a day to wash, rinse, clean up, they can just have the one kid come to school every day in a bubble or some kind of hazmat suit. Be okay with that, Kyle. At least the responsibility is on her and her parents. It's Doc Thompson, 700 WLW. Because of the higher energy prices, food prices are going up. We have seen the steepest rise in food prices in nearly 4 decades. The Producer Price Index rose seasonally adjusted 1.6% in February. The Labor Department said we have had the biggest gain in food prices since 1974. And it doesn't look like it's going to slow down anytime soon. I think the most obvious part of the story about the peanuts in schools is the peanut sniffing dog. If that isn't the red flag for you, if that isn't the part where you say, okay, we've gone too far now. I mean, I get the other stuff. You may have an argument, but peanut sniffing dog, we've crossed the line now. Rick on a cell, you're on 700 WLW.
Yeah, hi. I have a son that is highly allergic to peanuts. In fact, if he is exposed to peanuts, he goes anaphylactic in about 10 or 15 minutes.
About how old is he?
Well, he's 20 now, but
okay.
When it was in school, the teachers were advised of his allergy, and they advised every teacher and students in his class of his allergy, so that they knew, that if he was going to have lunch with the kids, and one of the kids was going to have peanut butter or something like that, he would sit, somewhere else and not disrupt the flow of the school and everything.
That seems reasonable.
They did have one. I'm sorry, what?
That seems fairly reasonable.
Yeah, one day some kid, out of sheer meanness, pushed a peanut butter sandwich in his face, and they kind of took that kid aside and actually took, with his parents there, showed him, put a pillow on his face and said, "This is what happens when Josh gets exposed to peanuts."
Now, I will say this, Rick. If you got a kid that's screwing around, and advise the kids, tell them what's going on, educate them about allergies in general. It can be a learning experience. And then if a kid does something like that, you're talking assault. That's really what it is, and the kid should be prosecuted or punished.
Yeah, and so, everything, and he was in, from the time he was in elementary school to high school, junior high, everybody knew about it, and there were no special things taken, having kids wash their hands or this or that. The only incident that I can remember was that in one of his science classes, they were doing an experiment with peanut butter, and the teacher said, "We're going to change it a little bit. We won't use peanut butter. We can use another substance."
That's
it'll
fine.
Do the same thing.
Yeah, that's fine. If you can do something like that, I have no problem. I appreciate the call. Is he still that allergic, by the way?
Yeah. He's had about 3 or 4 episodes where he's been exposed, and the doctors say, he's basically off the charts. every time that he's exposed to it and has a reaction, it's eventually going to kill him, is what it comes down to.
Well, I appreciate the call, Rick, and I'm sorry to hear that, but there is hope out there, and you might want to check into this. Maybe you've seen it. They're toying with this new treatment, and I don't know where they're at in development, how successful it is, and this is not something you should try on your own. But they have had some successes with exposing people to it, so they will build up their natural immunity. But they have to expose people that are that sensitive to literally one atom, one molecule of it at a time. And then they monitor them. And then, they do this every couple of weeks or whatever. And then after a year or so, it's 2 molecules. And they slowly build this up to desensitize them to it. Maybe there's some treatment hopes out there for you. It's Doc Thompson at the home of the Reds, 700 WLW.